Welcome to the program. I'm your host, Neil Howard, here on Health Professional Radio. Our guest is Dr. Danny Reshin. He's joining us today to talk about an American Society of Clinical Oncology abstract that he recently authored. And he's going to talk about CSCC, a form of skin cancer, and how it differs from other forms. Welcome to the program, Dr. Reshin, and thank you for taking the time.
Thank you.
So a bit of background about yourself, other than being, obviously an MD involved in oncology. Give us a bit of your background.
Sure. So I'm a medical oncologist. And I work at the Peter MacCallum Cancer Centre, which is a large comprehensive cancer centre in Melbourne, Australia. And I'm the director of the Department of Medical Oncology at the Peter MacCallum. And I've had a long interest in head and neck cancer and in cutaneous squamous cell cancers, which arise in the head and neck cancer, and that's where my interest comes from. That's how my interest began in treating this disease.
Well, let's talk about this recent abstract that you authored. How recent are we talking?
So the results were presented at the American Society of Clinical Oncology meeting, which just took place in early June, and the results were simultaneously published in the New England Journal of Medicine. So obviously recognising the significance of these findings by both the presentation at ASCO and the publication, a high-profile publication.
These results had to do with cemiplimab for patients with a certain type of skin cancer. What type of skin cancer are we talking about?
So we're talking about the squamous cell cancer of the skin. So when we think about skin cancers, we can divide them up into what we call non-melanoma and melanoma cancers of the skin. And the non-melanoma cancers are much more common, and they comprise of what we call these squamous cell cancers and basal cell cancers. The difference is that the prognosis for the non-melanoma skin cancers is much better. Mm-hmm. Most of them can be cured with local treatment such as surgery, but it's a very common disease, and there's proportion that essentially relapse and can't be cured with standard treatments, and that's the group that was targeted in this particular trial.
The group that was targeted, were there any age guidelines, or was it just a random thing as far as anyone, no matter what age, that had this type of skin cancer?
Yes, it was open to all ages. And I think it's important to highlight that this is a cancer that quite commonly occurs in the elderly. The main risk factor is ultraviolet, sun exposure, mm-hmm. and it's much more common in fair skin populations. And in people that have had considerable lifelong exposure to the sun. So the actual median age on the trial was 71. We do see it in younger patients, but the oldest patient on trial was actually 93. No. And again, that's a little bit unusual for clinical trials to have such an elderly population, but this is a disease that can occur in the elderly.
So you're talking about lifelong exposure to the sun. Obviously, if you've been in the sun that long and that often, you've experienced sunburn. You're up in age and you're experiencing sunburn, but something's a little bit different. What are some of the symptoms that say that this is something more than just your regular sunburn or a little bit of skin discoloration?
Well, I think if you've got any abnormality on your skin, if it's a mole that's changing colour, obviously concerned about melanoma, any sort of abnormal lump that appears, you need to see a doctor and have it treated. As I said, the great majority of these are easily treated and cured, but if they're not treated, or they just happen to be a more aggressive type, they can then either recur in that area and become hard to treat, or they can spread to other areas of the body. And that was really the group that previously we didn't have any effective treatment for.
What does the landscape look like as far as advanced CSCC, and is that something that was looked at specifically in the study?
Yes. So the trial, what's been published so far and what we've presented is predominantly in patients that have what we call metastatic disease. So this is cancer. The cancer is actually spread to lymph glands, or it's spread to other organs. And generally, patients were only eligible for the study if there was no curative treatment available that exhausted their surgery or radiotherapy options. And previously, we really didn't have much in the way of effective treatments. Chemotherapy had limited effectiveness, and in fact, on a worldwide basis, there were no approved agents for people with advanced cutaneous squamous cell carcinoma. So that's why we were interested in studying this form of immunotherapy in this particular cancer.
How was quality of life addressed, if addressed at all, in the study?
We don't have any formal quality of life measures results at this point from use of the drug, but this is a situation where patients had a very poor prognosis, often had lots of symptoms, and many of the responses were very dramatic. We saw many examples of people who had very poor quality of life, weren't able to do any of their normal activities, who were able to resume a completely normal life in terms of activities as they responded. So, without a formal analysis, it's fairly obvious that the quality of life of a high proportion of these patients improved dramatically.
In your opinion, what do you see as far as availability for this treatment?
Cemiplimab is undergoing review for approval in the US and in Europe at the moment. So hopefully that will follow through in the near future, and then it will obviously. It will be submitted for approval around the world. So I think that's probably the key in terms of getting access to the drug. There's a very large unmet need. This drug clearly benefits at least half the patients in this situation. So we'd be hopeful that it'll get approval and become available for patients. I guess the access will vary from country to country, but it's not obviously cemiplimab hasn't been approved yet.
Now, as you wait on approval, what clinical research are you currently working on in addition to?
Yeah, so the trial, this drug is being looked at in cutaneous squamous cell cancer in a couple of different settings. So these are the results in patients that had disease with metastatic disease. There's some more results. There are other groups being studied, including patients that have very locally advanced disease. Mm-hmm. And then I think we are looking at biologic studies to try and, from biopsies that have been taken, to try and understand the differences in patients who respond and don't respond. And so perhaps we can learn more about how to better use this drug or how to combine this drug with other drugs to increase the response rate even further. And then because the drug's so active, I think the next step in terms of clinical trials will be to start looking at the drug at earlier stages of disease. So potentially in adjuvant settings, in patients that are at high risk, to see if you can actually prevent the cancer from recurring or becoming or spreading to other organs. So I think there's lots of opportunities now that we've discovered that this this drug and this approach is so effective in advanced disease to change our treatment, look at whether we can change our treatment paradigms and increase the cure rate overall.
Well, we'd like to go online and learn some more. Where can we go and learn more about the Peter MacCallum Cancer Center?
The Peter MacCallum Cancer Center is accessible on the web. It's www.petermac.org, and so that you can certainly learn more about our clinical services and our research on that website. Well,
I thank you for joining us this morning, and I'm hoping that we'll talk to you again as approval takes place.
You're very welcome. Bye-bye.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Transcripts and audio of this program are available at hpr.fm and at healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, and download at SoundCloud. And be sure and visit our affiliates page at hpr.fm.